All right. Well, good afternoon, everyone. Thanks for joining us again this Friday afternoon in September. Just pleased to have with you, pleased to be with you today, but then also pleased to have two docs, Dr. Dan, as he's known, Dr. Daniel Fagbuyi. He will be letting us know how to stay out of the ER, which I think we all kind of want to do these days. And moderating today's panel is our very own Dr. Laura Lee Hall. So I'm just going to go ahead and pass it on to them so they can educate you about that.
Thank you so much, Brandon and Keiko, for your support. I'm going to share my screen. I have some introductory slides. Let me close this down so you all can see this. So I begin my introduction by saying not only welcome to all of you who are so interested in promoting the health of people of color and diverse communities and underserved communities, but how do I introduce a man who really needs no introduction? So let me share with you some of his accomplishments. Dr. Dan Fagbuyi, known to his patients as Dr. Dan, a distinguished ER physician, a biodefense expert, chief medical officer, war veteran, assistant professor, and also a media expert. He served as the medical director for disaster preparedness at Children's National Health System. He served as an infantryman and battalion surgeon on the front lines, caring for over 800 soldiers and several hundred Iraqi civilians, part of the Screaming Eagles. He's authored numerous medical articles and delivered expert testimony to bipartisan committees and congressional leaders on the Hill. He's really a medical expert who seeks to empower the public by providing timely, tangible, and easy to digest public health information and education. And he's appeared on some of the most important media outlets, as you see here on the slide. Here's Dr. Dan in the picture. And now NMQF is added to the list. I want to just share a few reminders of where we are. Hospitals overwhelmed by COVID are turning to crisis standards of care. Average daily US COVID deaths climb above 2,000 per day for the first time since March. More Americans have died from coronavirus than the Spanish flu in 1918. So this is not a time we want to overwhelm the health system, given what's happening in the pandemic. This little table, which you probably can't see easily, simply makes the point that people of color are at higher risk of COVID infection, hospitalization, and death. This graph shows you that Hispanic populations and Black populations, there remains a huge gap in terms of flu vaccination. So this is over time. And the result of that is that people of color have been hospitalized, admitted to the ICU, and even died over the last 10 years from flu-related illness. So it's a dire place that we're at. And that's why we're so lucky to hear from a renowned communicator and medical expert on how to stay out of my ER. Not a very welcoming remark. I will remind everyone to please type your questions, not into the chat box, in the question box. And with that, I will stop sharing and turn it over to Dr. Dan.
Hi, good morning. Thank you, Laura Lee. Appreciate that. And thanks, Brandon. Yeah, good afternoon to everyone, wherever you are, depending on which time frame. I hope you all can hear me clearly. Yeah, it's that time of the year where we start worrying about flu and other viruses. So let's kind of set the tone for today and what we're going to talk about. So how do we keep you out of my emergency department, as if I own it? There are many other emergency departments that various number of physicians and providers, nurses, allied professionals, patient care techs work at. We're all part of the healthcare team. And it is important to kind of figure out how can we keep our patients out of the emergency department? How can we keep them healthy? Is another way to look at it. Because when you usually come into the emergency department, it means that pretty much, quote unquote, something's hit the fan, right? Or something's at least scary enough to get you to the emergency department, to get you concerned. So the intent is not to have that be your case or your story, and it's to really try and address the most important things that are important to us in terms of our health, our well-being, and also being around for our loved ones. So with that said, what are some of the things that we need to consider? First of all, you need to make sure you do have a primary care doctor, okay? Some doctor that you see on a regular that knows you very well. And you should be going for your regular care. Yes, we have SARS-CoV-2 running rampant. COVID is real. Um, uh, First, I guess I would say if you haven't been immunized or vaccinated, you should strongly consider that. I understand that people have their choices, but based on the death and the number and all what Laura Lee just shared with us previously, it is important for you to be vaccinated and to protect yourself, wear your mask, and do all the things, and for your loved ones. Um, the other part that I would say is yes, when you have your primary care doctor, make sure you utilize that resource for your emergency and healthcare needs. Contact your doctor. As I'm not your doctor, but this is for informational purposes only. The other thing that I would say that is important to emphasize is prevention is better than cure, right? So, what are the things you can do that we can all do together as a community, or having that sense of community where we can all be a part of the solution? So, some of the things are um, prevention. That would be eating healthy, okay, trying to eat the things that are appropriate for you. Trying to do some exercise as best as you can, all the things that are important for you. And in addition, immunizations, preventative type stuff. So in this case, we know we're going into the flu season. We're already seeing, and I'll just give you a snapshot of what we're seeing in the emergency department now. We're already seeing cases of RSV, respiratory syncytial virus. It's a virus that affects children and affects their lungs and their little airways, especially kids under 2, and especially kids who are premature or born prematurely. Can lead to death, respiratory distress, and other things that can be scary. They can even stop breathing, have apnea episodes, seizures, so many different things. And it is scary to observe, but it actually it causes death in kids about this age and about this time of the year. We're already seeing cases of RSV. So now we've got COVID, right? We've got RSV and we've got flu coming. Flu typically peaks between December and March, but it already starts usually around October, November. So you have heads up now to get your flu shot. Very important to help lessen the chance of you coming to the emergency department for flu-like illness. And by the way, when you come in with a flu-like illness, guess what we're going to think? We're going to think of SARS-CoV-2, right? We're going to think of RSV. We're going to think of other diseases, the disease processes. Those are things that are going to be concerning to many providers and many of us that are going to be worried about that. So we're going to have to do testing to do all those things. And guess what? There are other people who are seeking the same care, concerned about flu, SARS-CoV-2, RSV, other illnesses, pneumonias, other things that bring them to the emergency department. Then there comes the overcrowding and all those things. So I'll kind of break those things down. So the things you can do are making sure you're trying to stay healthy. You are able to contact your primary care provider. If you don't need to go to the emergency department, you don't want to just show up and be concerned about something that you didn't even talk with your primary care doctor about, but yet you're going to the emergency department. You know, your doctor can help you kind of figure out what's the best move for you so you don't burden the system. And also don't spread disease or also don't catch something. Because usually when you come to the emergency department, we usually give you a parting gift. It's called the parting gift for a reason. So those are some of the things I say that you would think about. So on the prevention side, things you can do, get vaccinated. By the way, a lot of people usually ask, so Can I get vaccinated with other vaccines at the same time? And more specifically, they narrowed it down to the fact that, we have SARS-CoV-2, the COVID vaccine, and we also have the flu vaccine available. Can you get both at the same time? Yes, you can. So we answer that question. So on the CDC website, go to www.cdc.gov. You'll see that information on it. So it can be co-administered, meaning it can be administered at the same time. So don't let anything hold you back. Also, make sure you understand that it takes about 10 to 14 days before the vaccine takes, or so to speak, when you have that protection, so to speak. So you want to get it in earlier before the season really takes off. We don't know how the flu season is going to be, but this is your step to be, it gets forearmed, as they say, to be forewarned is to be forearmed. So that's what I would suggest that you would do. What other things can keep you out of the emergency department? Knowing what your signs and symptoms are. What are the signs and symptoms of flu? So they may have body aches, chills, runny nose, cough, cold type symptoms, even shortness of breath. One of the classic things is where we see actually people may have that kind of flu-like symptoms, and they nurse at home and manage themselves. They speak with their doctor. They do fine. They take their Theraflu, their whatever number of kind of symptomatic relief treatments that you take. And then what happens? They feel better. They're doing fine. And then a week passes. Literally, it's usually a week, 10 days. And then all of a sudden, they get this new onset of shortness of breath, where they're having some difficulty breathing, coughing, and the symptoms feel worse with the return of the fever that they had the first time or may not have had. That's usually a very important sign. You should definitely call your doctor. That warrants a visit to the emergency department most of the time, because actually that can be a new onset pneumonia, because sometimes after the flu, people can get pneumonia. So these viral illnesses, you get a superimposed bacterial infection or a pneumonia on top of it, which can be deadly. So those are the things we don't want to miss. And I also want to make sure you're aware, so you know. The classic story is they had the flu-like symptoms. They got over it for about a week, 10 days. Not an exact science, but somewhere around that time, he had recovered. And then all of a sudden, a return of worsening of symptoms and the shortness of breath. Definitely make sure you contact your doctor. So those are some of the things you should be aware of in terms of the symptoms and how to prevent yourself from coming to the emergency department. Healthy eating, healthy living, activities, and of course, immunization. So flu vaccine, COVID vaccine, whatever you can take that's prescribed by a doctor, definitely would be some of those things. All right, so what are the things that we do see and the burden on the emergency department, why you don't want to come to the emergency department, okay? I'm not saying don't seek care when you need to, but if you don't need to, how can we be a part of that sense of community to understand why is it a big deal about coming to the emergency department? Well, you probably heard Laura Lee mention about crisis standards of care. That's another element that we're going to start to be dealing with. Some states are already dealing with it. In fact, I'm going to be having a discussion on Clubhouse about this on this Saturday at 5 p.m. Eastern Standard Time, literally about crisis standards of care. What are those implications? What does it mean? What is CSC, by the way? Well, it just means basically our fancy taboo word for rationing of care. We don't want to have to ration care, meaning you bring your child in and they say, well, the child doesn't look that sick. We got to take care of this other child over there. Or you're here with coughing, but we have another patient over there who's coughing and can't breathe, and we're taking that patient over. People might feel some type of way, rightly so. It's only human. You're going to say, why? Why am I being discriminated against? And we know which populations are going to be affected. The minority population is going to be affected even more. What's also the toll and the impact also on the provider, the healthcare provider, the doctor, the nurse, the healthcare team? That's also going to have to make these decisions. Ideally, they shouldn't be making these decisions. There should be an arbitrary team, or at least a certain protocol and algorithm that says, hey, you meet these criteria, then you actually get afforded care when there's a scarce resource, be it a ventilator, be it a breathing machine, be it even medication. All those things can be concerning, and it's hard to kind of tease out. So you should be aware of these things. In fact, I think the public needs to be really engaged on this. So you should be aware of this. And you can start to have these conversations with your doctor and also the departments of health, because the states will actually have to give some guidelines on what they actually recommend for other states to be doing. If you're a healthcare worker, all the other risks, what does this mean in terms of risk and liabilities for you? Like if you withhold care, is that something you're going to get sued over, and all these other things? There's so many things that haven't been discussed. We've been talking about this for years. People weren't paying attention to it, but now that we've got COVID and we've got this going on, maybe people start to listen and start to be involved in that decision making. What is the right way that we ration care if it requires that? We don't want to be in that situation, but push has somewhat come to shove. And if that's what we're going to be seeing, if we have large cases of flu and COVID and RSV and other things and the winter emergencies that we will typically see, it's going to be really, really rough. I don't mean to be grim about it, but that's what we anticipate. So we have to be prepared. This is where your role comes in. How do you get involved in that? How do you not become a burden to the system? Do you know what CSC means and what that is, the crisis standards of care? What are the risks of that? Have you had that conversation with your doctor, family, friends, and things like that? Who's going to get help, care withheld? Who wants that? I mean, so there's so many things to consider. There's a lot of ethics that are behind this, and it can be very challenging. Also mentally for the healthcare provider. I mean, you know, nobody wants to be the one to make a decision like, oh, I'm withdrawing care, or we can't do this, but we got to save this life and do that. The way we were trained in our medical system was totally different. We save all lives and we try to do everything for everybody. But when there's limited resources, the question is, do you worry about the life of years that you save or the lives saved? Or do you have a balance between those? So, in other words, do you say women and children first? Do you say pregnant women and children first? Do you say elderly first? You know, what are those issues? Do you say, should race be a factor in there? There's so many questions. So hopefully this lets you kind of think about how we're thinking about it or how we should be thinking about it. And then what's your game plan? You really need to think about what your game plan is. So what are you doing to not be part of the problem, to be part of the solution, and to have that sense of community? So those would be some of the things I'll say. And I'm done ranting. This is the time where you get to ask some questions. But I think those are the main things I wanted to make sure I really did highlight.
Dr. Dan, thank you so much. There are some questions, and I have some questions as well. So since there was negligible amounts of flu last year, do we really think it's going to happen this year? It's going to be worse? Won't our continued use of masking, for example, protect us from the flu and make the flu vaccine less important? What's your take on that?
Those are excellent questions. I wish I could say I have a crystal ball. I don't. I'm only going by what we've seen before and going by history and going by the evidence that we have and also anticipatory guidance. We have to cover all bases. Be prepared, okay? If there's one word we should know, we've heard unprecedented all year long. I hate that word now. There's one word that we should be talking about that we don't talk about. Is preparedness. Literally, preparedness for all this climate change stuff, preparedness for COVID, preparedness for flu, preparedness for terrorism, preparedness for everything. What's your game plan? How are you prepared to cover all bases? Your contingency plans, your backup plan. So, I digress, but the point is that preparedness is important. And so with regards to the flu, there have been some data that shows that there's flu cases already on the other hemisphere. So that's where we're getting data from. Usually we say, okay, we'll see how it is over on the other hemisphere and then use that data to say, okay, we need to be prepared for the flu. It's going to be this one. They select the specific type of strains that may be circulating that we should anticipate. It's a guess. It really is. It's a best guess, but it still is a guess. So sometimes it misses, sometimes we get it right. So I don't know. Hopefully we're guessing right this time. But yeah, we're probably going to see flu. How bad it is, I honestly don't know. I'd rather tell you I don't know because I don't know. If I do know, I will tell you. But we probably will see cases of the flu. Reason being because, yeah, last year when COVID was really raging, we were really wearing our masks. We didn't have gaps in which where people were pushing back after the whole phase of the initial pushback. I anticipate also because of the fact that we're seeing more volume, more mixing, and people are reopening, certain states aren't really caring about whatever's going on. So we'll see some mixing, and it's going to be cold winter weather. So I anticipate we probably will see some. I don't know how bad the cases may be, but we have to err on the side of caution and prepare for the worst, and then expect the best. But in that case, so definitely masking is important. Yes, did it help last year? We believe so. Will it help this year? It probably will, and it probably should be part of our lives. Like really, we saw the playbook. We lived the real life example, so we probably should be masking and embrace that. So we'll probably see that it does not mean that the vaccine is not valid. So the vaccine is still valid. The mask protects you, but to a certain degree, right? So in the cases where you do pull down the mask to eat, to drink, to do whatever, and you get exposed, and you do get the flu, if you've been vaccinated, it'll protect you and hopefully keep you out of my emergency department. So I think it is important to add that nuance. It's kind of like what we're doing with COVID. So mask and vaccinate, the same thing, mask and vaccinate. They're both viruses. They're different kind of viruses, but that's the same thing. And we have something that you can use. So I would take everything. And in fact, actually, while I'm here in the hospital, I'm going to be getting my shot today.
That's great. I mean, the discussion of crisis standards of care certainly give me great concern, and I would want myself, my family, my colleagues, my neighbors, my community to get vaccinated so they don't have to be run into that problem of being the one who maybe isn't able to get the care they need. So we have a question in our Q&A about primary care. And I'm going to just kind of build on that topic a little bit. The question itself is, do you have any suggestions for people who have primary care providers that are encouraging patients with underlying conditions to not get vaccinated for COVID, contrary to CDC recommendations?
Yeah, I'm unabashed about that. Fire your primary care provider. Get a different primary care provider. And I don't know what primary care provider is going to tell you if you have an underlying medical condition not to be vaccinated, unless they know there's a risk factor. And it doesn't sound like there's any other risk factor other than the risk in favor of potentially getting disease, is what I gathered. If there's a contraindication, sure. So while I said that tongue in cheek, fire your primary care provider, find the right primary care provider is what I'm really trying to say. Primary care providers are very important. They are the medical home. That's where you go. They know you like the back of your hand, and you trust them. So that's who I would go to. But if there's there's some oddness about the fact that they're not advocating for you to do some things that we know in the medical literature is important, and in the medical field is important, you can seek a second opinion, a third opinion, get a different provider to see what's out there, because that might not be the best decision. That might be the primary care provider losing objectivity and putting their own values on you, as opposed to looking at you as the risk of the patient and what the literature is saying. In fact, the medical boards across the states are looking at doctors who are spouting misinformation and disinformation, or who are not following the guidelines medically and are taking away their licenses. So you're going to hear more about that. It literally is ongoing. I already know a couple of cases where they've already pulled and yanked their licenses. So make sure you have a licensed provider who is looking out for your best interest.
So I have many colleagues who are actually serve in primary care practices, and they sound like emergency departments in terms of having such a high volume of patients, struggling to hold on to nursing staff, for example, because of I don't want to call it just stress. I think there's trauma of being a healthcare provider in the steady flow of serious illness. So do you have any advice for the primary care teams in terms of implementing a flu vaccination program in the midst of a very, very busy and terrifying season?
Yeah, great question. So in my past life and still what I do advise companies, organizations, hospitals on disaster preparedness. And one of my previous roles as a medical director, one of the preeminent facilities was to try and come up with a flu plan, and we called our Code Navy team plan. Basically, I was the acting incident commander, and in this case, we drew out a set of rules and protocols that we would follow and how we would surge, so to speak. And surge is where you have limited resources and you have to now improve your access to those resources and execution of those resources by making it happen magically, right? So imagine a case where you can increase your staff up maybe 10%. So you're at 110%. But now you get a surge where you have more patients than you can typically deal with and more resource needs. And you still have to staff up and ramp up maybe even 150% to 200%. So now you don't have enough staff, but you have to do twice as much of the work, maybe even 3 times as much of the work. So
Right.
what are some strategies around that? Well, you have to look at resources that you have. So, for example, a primary care staff office, like you mentioned, they may have a head charge nurse or a head nurse manager. I would definitely make sure you implement your vaccine campaign, just probably like what you did for COVID. Don't try to reinvent the wheel. Use what works, use what system works. That's very important. So you're not trying to figure that out. Ideally, there's some situations where you have that nurse manager be in charge of giving the vaccine to everybody in the clinic or in the primary care office, so that that person has been tasked with that task. That's all they do. They can do other jobs, but their first priority is to make sure everybody's vaccinated. One that eliminates the fact that you'll have a lot of call outs and sickness and illness, because you need them, as we in the military call the war fighter. So they're your
Mhm.
frontline fighter. You need your soldiers fighting. So you need your workers working in this case. So I would say that's an important thing. I would ensure that you have maybe a backup call schedule if you are able to have that, to be able to have some people cover. Also,
Mhm.
communication is very key. So you want to make sure you tell your clients, your patients, your customers in this case, that, hey, this is what we're going through. We have shortness of staff. Our waits may be X number of time longer. So if you need to come in, you can come in on these alternating days and things like that. So work around their schedule to try and feed
Mm.
the needs that they do need during those times. So also trying to streamline things. If it becomes a massive flu season, you may want to cohort patients, meaning putting a group number of patients that have similar type symptoms, such as influenza-like symptoms, together in a certain area, and those who don't. So they're separate, or maybe even have alternate days for just sick call visits that aren't related to running those cough, cold type flu symptoms, who may come in for other type medical, maybe it's just maintenance. Maybe they're just here for their vaccination. They just want to get flu shots. So you have a separate day for flu shots and you just do all flu shots. That way you're not having people mixed, but also you can streamline the response and the staffing to address those needs. So those are just a snippet of some of the strategies. We have some articles on that, which you can reach out to NMQF on,
Oh,
that can
thank
give
you.
you some of those things. So,
We have one question about when should you go to the ER? I know you want to keep them out of the ER, but if you have flu or COVID symptoms, when should you go to the ER?
yeah, this is a good question. I think everybody's emergency is different, and what you deem emergency might not be what the provider might deem an emergency. Might not be what anybody deems an emergency. So you go with how you're feeling. However, as I said, it's important to have your primary care doctor. Your primary care doctor is that one person that you can call and reach out to and say, hey, this is what's going on with me. Um, what do I do? And your primary care doctor will navigate you the right way. That's your GPS. Hey, go to the emergency department. Oh, I think you can manage at home and you can take some of this and just call me in the morning, or I'll check back on you in a few hours, blah, blah, blah. That's the relationship you build. So that's your decision making. I can't tell you when to come in. But I know one of the signs and symptoms, or a couple, that definitely should be leaning you towards coming to the emergency department. If you ever have any shortness of breath, difficulty breathing, that's a no-brainer. You can't breathe, you can't breathe. Hey, I'm not there. Your doctor's not there. You go to the emergency department if you can't reach your doctor. So that will be a quick decision making. And whenever in doubt, you talk to your doctor. Also, there's 911, right? That you can go through the emergency protocol. But your primary care doctor will always be the first person I would say you contact unless it's something acute, life threatening. You really feel like you're about to die or something like that.
Thank you so much. So the $1 million question of the day is, who should get a booster shot? You've seen
My favorite
obviously the
question.
FDA and
Yeah,
CDC, and now they've added healthcare providers as essential workers.
it's
What's your
very,
advice?
yeah, it's very interesting. So again, my thoughts on this is all for informational purposes only. I actually put this on my IG Live when I was interviewed on Cheddar or one of the other outlets. Um, I've been saying, the data is showing that the vaccines are doing what they're supposed to do. As we say in the streets, it's doing what it's supposed to do. It do what it do. Okay. So if it's doing what it's supposed to do, then it's not broken. Why am I fixing it? That's what I would ask. Then we look at the science and the data from other countries, from Qatar, from Israel, from the French study. And when we pull all those data together, and the CDC also did their data and study analysis here, when you put all those things together, there's certain things that add up, certain things don't. And certain populations are different from other populations. And you have to have the same definition. Certain definitions weren't the same in the Israel study that were for us. So symptomatic disease and severe disease were not the same. So that was one that stood out to me. So I say all that to say these are what I stood on. I've said I agree with the 65 and over. I agree with those who are immunocompromised or have some immune system problem. They should probably get a booster based on the data and the fact that we know that the antibodies do wane over a piece of time. But that doesn't mean that's the end all. There are a whole bunch of other clan of cells that are part of the fighters of your body. Those are the B cells and your T cells. And you got macrophages. So they're all still part of this response. They just, they're just waiting. So they see the suspect SARS-CoV-2, they show up, or in this case, any other foreign invader, they'll be ready to pounce on it. But that doesn't mean that your body is not ready to fight. We're just looking at antibodies is not the only answer, is my point. That's what I would say. The other part about that is, so those who get the booster, now there's the guidelines that FDA said, and I actually agreed with kind of what I've been saying for the past 2 months, so it's good to hear that. However, they did entertain also frontline workers. And the frontline workers that they at risk, where, frontline workers specifically like doctors, nurses, school teachers, grocery workers, those up front, basically forward-facing folks who may be at risk. And at risk could be anything from diabetes to hypertension, heart problems, and all those other things. So I do understand that. And for those who need that, I think it's reasonable. Okay. So then CDC ACIP group said, well, it's everybody, all the group that we mentioned, except we don't have to worry about the healthcare workers and the teachers and all the others. But then the CDC director overruled that and said, no, we need all the forward-facing folks all included in that, pretty much, which led an open net for anybody 18 and over who's at risk, forward-facing or whichever, could get a booster. So that leads it up to the individual to make that decision. Those are kind of difficult challenges because, it's mixed messaging. It gets the crowd kind of confused. But I think if there's any take home points, I definitely know some things that I can stand on. Definitely. The 65 and over, no brain. Those who are immunocompromised or have some type of immune problem, HIV, cancer, you name it, liver disease, whatever that's causing your immune problem, no doubt you should get it. Healthcare workers, teachers, forward-facing, who are exposed constantly, grocery workers who have a risk factor, such as diabetes, hypertension, and all those other things, and fall into that. It's been over 6 months, actually over 8 months since I've been vaccinated. May consider, I think that's reasonable to consider a booster, and that's where I would leave it. And because the real question that should be asked is there any incremental difference or benefit by getting the booster in the population that you're giving it to? And in those populations, the other populations, other than the first two, which I really mentioned, there's no evidence of that.
Mhm.
It's no evidence of incremental benefit. So until there's studies that show that, yes, we know the antibodies do wane, but what does that mean? Okay, so it waned. I still have T cells and B cells. Is that good enough? Does the Delta variant care about that? So those are the balances and nuances that we have to factor in that. So I'm still in the camp of wait and see and give the booster to those that we had mentioned at risk and over
Mhm.
65. And for those healthcare workers and forward facing folks who feel they're at risk and want to get it, more power to you.
Thank you for putting it that way. I loved how you started talking about prevention as, trying to eat a healthy diet and get some exercise. And the vaccines obviously are part of the prevention armamentarium. We have a couple of questions on kids. One is, what is prevention among kids? And does it include a multivitamin? So that was one of the kid questions. And I believe you're a pediatrician, isn't that right?
Yes, in my past life, but I guess once you're a pediatrician, you're always a pediatrician.
That's right. That's a special doc. So why don't we stop there? And if you could kind of address the issue of prevention in children.
So yeah, I think prevention with children, sure, they should be taking their multivitamins and things like that. But it's really a balanced diet. And with regards to this disease or SARS-CoV-2, it's trying to mask them and also being vaccinated around them. So the adults and those who are in the age range who can receive the vaccine should be vaccinated around them so they can act as that kind of shell of protection around them. That's
That-
ideal.
So that's the other question was, how do you protect your children who cannot be vaccinated against COVID?
And make sure you're vaccinated. Make sure the people they come in contact with are vaccinated as best as you can. There's certain things you can't control. In those cases, you have to have them masked and teach them those values because they can be bullied, they can be persuaded into doing certain things. There was a story from one of my colleagues who had shared that a child was supposed to take some photos and the child had a mask on and everybody else took their mask off in the photo. And the child was like, "No, I'm not taking the mask off." And they said, "Why? Why are you not taking the mask off? It's okay. It shouldn't be a problem. Everybody's taking their mask off." "No, my mommy said not to take the mask off, and I'm not taking the mask off." So that
Mm-hmm.
was a child who was definitely adamant about where he stands. He wasn't confused, and it's up to us as parents and family members to inculcate that in our kids so that they can stand on their ground 2 feet. Like my mama said, and when you say my mama said, that's it.
That's right.
Yeah.
Oh, praise to the power of mamas. And so I want to ask you a question. And you didn't say get your flu shot, but children should get a flu shot each year as well. Isn't that right?
Definitely, definitely. Yeah.
Um, so I'm going to wait on these other two questions. I want to hear you. You're such an able communicator. So what do you do to convince patients, people in your community, to get a flu shot if they're kind of no? And I guess I would add COVID as well. But how do you address that, especially among people of color who may have some mistrust, who may be particularly, attacked by anti-vaxxer literature? What's your strategy? How best can we assist people of color who don't want to take the flu vaccine to go ahead and do so for their own protection?
Yeah, that's a good question. It's very simple. I think it's just being open and being real. Just it's something I guess I do often. It's just I'm just me, so I tell them. what's the fact. But I think important is always to know people's why or why not. If you can find out their why or why not, that's half the battle. Because some folks, it might just be all about they just don't like needles. I found that out just by asking for it. They just don't. It's not that they didn't fall into a conspiracy of the shot or
Mhm.
some story. It was really about it's the needle. They just don't like needles. So is there another way? Well, guess what? There's an intranasal flu vaccine, and that person qualified. And I told them, hey, you can get a nasal flu. There's a nasal flu. Yeah, there's a nasal flu vaccine. You can get that. You qualify. Talk to your doctor. Got the nasal flu vaccine. Problem solved. Sometimes it's not always that easy. There's others where it's just conspiracies about when I get the flu shot, I'm going to get the disease. I'm going to get the flu. Every time I get the flu vaccine, I get the disease. So I don't want to get the flu shot so I don't get sick. Well, how did you get sick and what happened and when did you get the shot and what were your symptoms? Oh, I got the shot and 2 days later I had the flu and it lasted for 2 or 3 days and then that was it. But I had the flu. Like, well, you had 2 or 3 days. The typical flu is usually 7 to 8 days, maybe even 10, and it's painful. It hurts. It knocks a
Mhm.
whole soldier like me down. I
Mhm.
know it's flu. And so we've had those discussions. So I think it's important to let people know. And while we're at it, no, the getting the vaccine does not give you the sickness. So you don't get sick from that. Now, part of getting the vaccine, your body does rev up and starts an immune response. And in the immune response, sometimes you have some soreness, some redness, some swelling at the site. Some people might even have fever. That's all normal with the immune response. So sometimes it's just the vaccine taking, meaning it's revving up so it can do what it's supposed to do. And sometimes there's some people who, just as they're getting the shot, they had already had been exposed to the flu and they had the flu true proper. It's not often, but it does happen. So those are some parts of it. But looking at the consequences or the outcomes that we see in patients in the emergency department coming in with respiratory distress, difficulty, pneumonia, and also sometimes some do die. Some get Guillain-Barré, different types of neuropathies and weaknesses and numbness and tingling and things like that. Those are other concerns. So you have to look at the risk benefit ratio. Do you want to also have all that time off for work? Do you want to get other people sick? Do you have elderly in the house? We also have to have that sense of community. So I think it's important to find out people's why and then meet them where they are and have that discussion about it and address some of the myths that are usually associated with it.
I noticed you didn't bring up pharmacists and pharmacies as a good place to get a flu, especially if your primary care practice is overwhelmed. I wonder if you'd say a few words about pharmacy.
Yeah, so actually it was part of the policy about 10, 12 years ago that we worked on with HHS in terms of it's a pathway called ESAR-VIP where we basically deputize people, allied health professionals, veterinarians, pharmacists, and other techs basically get upgraded in terms of their licensure, or at least in terms of their capability to do certain things that weren't previously in their job description, but it's authorized during times of an emergency. In this case, in COVID, we did this also. But in other cases, in emergencies, we do that where the pharmacists are allowed to give vaccines, dentists, veterinarians, and things like that. But every state will have their own thing, but usually you need to pay attention to those rules. But to the point of the pharmacists have always been allowed to do that. So that's an area that can help you with your surge or with your increased volume, and you can actually funnel and maybe even have discussions with the pharmacy to say, hey, we're going to send you our patients, they're going to come to you, and you can have a memorandum of understanding or an agreement, or you can just have them do it on their own and just go get the shot there. So that's another site. Yeah, it's a very valid, perfectly valid place to get your vaccine.
So we had one question that concerned, it was really two questions. So in the era of telehealth, how can that be a tool to promote flu vaccination or COVID vaccination for that matter? So that's question one. Question two is, how do we really reach younger people, young adult males especially, who seem to have the lowest rates of flu vaccination and COVID vaccination? So telehealth's impact and the young male, how do we reach them effectively?
So with telehealth, both good questions. Telehealth, I have to think about that, but we use that to see patients right now, and in the era of COVID, it's come on board more. How would I say? Actually, uh, quicker than thought possible. And as soon as it starts to get fully compensated, I think a lot of providers will switch to it if it's going to be something constant. So actually, that also helps with surge, right? They don't have to come into the office. It can prevent disease spread by meeting them where they are, literally. So they can be at their home, and you can pop up on the telehealth monitoring. You can see your doctor, and you can have your conversation, or your nurse, or your nurse practitioner, or any of your healthcare providers, and have the exchange of information and make sure you're doing okay. There's some things about telehealth that even adds more value, the sights and sounds and smells, but you're more so the sights that you can see, the background, what's going on, everything okay, how are you doing, things like that. So I think it can be helpful in disease prevention, at least because people aren't having to show up. So leveraging technology is important. With regards to the vaccine, you can't get the vaccine obviously through an electronic pathway. So they're going to have to go somewhere, but you can send their prescription somewhere to the pharmacy, as we had mentioned, or there can be certain sites where they can actually meet and get their vaccine, but you can coordinate that all electronically. So that's one. With regards to the adolescents or the younger crowd, even younger adults who are somewhat resistant, hesitant, or not trusting, or who the medical community has violated their trust, or the U.S. government has violated their trust without putting burdens on them. Yeah, it's again trying to meet them where they are. Hip hop is a great culture, and I'm a fan of it, and it's another way, a way and where to meet folks. In fact, I'm doing something with Hip Hop Atlanta, October 2nd and 3rd in Atlanta, where we actually engaging them with regards to vaccination and encouraging them to get the vaccine, but through hip hop. So I think those are some ways. There are some of our colleagues who actually work with NMQF also are doing stuff in barbershops and hair salons, and other places where people, younger people, may congregate to try and meet the community there. So I think that is important. I did a live discussion with DJ Scream, who's a very popular hip hop DJ, and literally we had a fluid conversation. So you can go to my Twitter page, you can catch that, or go to DJ Scream's IG or mine, and you can get some information on that. Great candid conversations, just real talk. No BS, no chaser, just let's have the conversation so people can, understand. At least you can't say you didn't have the information. And you can make your own decision without shaming people, but trying to be there as a support, having some empathy, everybody giving each other grace, but also understanding you have to make a decision, the red pill or the blue pill.
Thank you. That's very interesting. Maybe we can share some of those links after this meeting with our audience so they can look at them, make use of them. We do have a question about Moderna and booster shots. So I will lob that over to your side of the net.
All right. And I would say with regards to Moderna, this is going to follow the same pathway as Pfizer is, but let's not mix words. Moderna's data shows that their vaccine is superior to Pfizer, at least based on in terms of the lasting length of antibody. Let's be clear about that. So that's what it is. The CEO of Pfizer might not agree. However, based on the data that it says there, you can see the gap in terms of how long the antibody response lasts. So I would say, yes, eventually you'll probably need a booster for Moderna too, but the question is when. I don't know. We'd have to see the data and see when does that antibody level drop off, what time frame. And my question to the booster is, or at least my thought on this whole thing is, I'm good with the booster if you're telling me the booster is updated with the latest new variant. But when we go back in time again, as I said, the vaccines are still doing what they're supposed to do. They're keeping us alive, keeping you out of the hospital, out of my emergency department to put a tube down your throat and send you to the ICU. So if you're not getting a tube down your throat, going to the ICU or dying, I think you're doing pretty fine. Now, there's also inherent risk, of course, we don't know and we're still learning as COVID is keeping us all humble, is that there's some, who will have, develop long-term COVID and that brain fog and all the other things. So that's the scary part that we have to really take heed about. And I think a lot of people are missing that with regards to the vaccine. They're like, oh, I got the disease, I'm good, or I'll just get it, it'll be mild. Yeah, okay. Oh, it's 97% of the people survive. No, that's not the right number. That's the ones that didn't die. But what about their quality of life? So there's another 33 to 37% that have brain fog, that have weird tastes and weird smells, that have maybe developed clots and end up dying, that have heart problems and other things that are related to long COVID. So that's really the question. And the things that we don't know yet, we're not smart enough to know. It's unknowable at this time. We'll find out in the future, 3 years, 5 years from now. Oh my God, guess what this had? So all those who had this mild disease or had moderate disease of this has this, or potentially could have this. We already seen data that's showing the brain, the frontal cortex shrunk in patients who had long COVID. So those are some of the things that we're going to learn. So we got to keep humble and we got to protect ourselves.
We have a question about monoclonal antibodies. And then I think that I'll just ask others if you just put your question in the Q&A and we will definitely get answers to you. But maybe you can talk a little bit about the monoclonal antibodies, and then I want to share a couple slides as we close up.
Sure. So monoclonal antibody is great. There's a monoclonal antibody locator. If you go to www.hhs.gov, look under monoclonal antibody, it'll tell you where in your location. You can just put in your zip code and it'll tell you the nearest monoclonal antibody center. So that's important. You do not come to the emergency department for monoclonal antibodies. Okay, so don't go overwhelm the emergency department. They probably won't even know where it is. Like, huh? But there are centers that are out there for those who are at high risk. I think it's approved for those who are greater than 12 or 12 and older, who have high risk of developing severe disease. And yeah, so that's an option for folks, and it's been helpful. Yeah.
Well, I think that one of the take-home messages is really get your flu shot so you can reduce that risk of on top of all this other scary stuff. And what I wanted to share with people before thanking you is to let them know we have a number of resources. So if you're an individual and you want to promote prevention of the flu and COVID, we have opportunities of training and support and resources. If you're in a healthcare system, we have a huge number of resources that you can use to implement a flu program, to educate your patients, to become a pharmacist ambassador in the community so you can provide information just like Dr. Dan did now nationally. Community leaders, you talked about the hip hop leaders. We are definitely looking to support community leaders around the country with communications, virtual town halls, on social media platforms. We have developed a Faith Health Alliance, so clergy who want to be a source of trusted information and even vaccines. We are working on that, and barbers and stylists, we're working with Stephen Thomas to expand that network so that you can really be someone who listens to people in your community and provides good information, and again, connects up with vaccinators. So please reach out to us. We put it under the title of Drive, drive toolkit, I wanted to even say, and I know this bar is in the way, forgive me, that we even have grants for community organization, FQHCs, to work on this issue of flu and COVID vaccination. So let me see here if I can give you a contact. I'm sorry, I've got my graphics all. Email us. We really would love to support every voice who wants to promote health in the communities of color and diverse communities. Now, what I'm going to do here is I'm going to stop sharing, and I am going to offer a great big thanks to Dr. Dan. We really appreciate you sharing all the things that and from you've learned and know from your many roles, and preparedness and surge. I heard those words from your military background. Let's all be prepared. And I thank you. Stay well. Thank you, everyone.
Thank you.